Hi, Michelle. Thank you for coming in today. Before we head over, I just want to give you some background information on Chelsea the mother and her daughter Lily.
Sounds good. So today's her 4th week postpartum visit, right?
It is. I've actually been following up with them in the community since their discharge from Foothills. Last time I visited, Chelsea was expressing concerns over being a new mom and feeling sad when she thought she should be feeling blissful. I gave her the Edinburgh postnatal depression scale to fill out to see where her difficulties were and where I should focus my nursing care. Can you tell me a bit more about the scale?
Yeah, from my research, I found that it's a 10-question self-administered tool to determine if there is a presence of postpartum depression. However, I've read that it's not meant to be diagnostic and is only used to see if further consultation is needed.
Good. It sounds like you have a solid grasp on the reason for the follow-up today. Considering her concerns from last time, can you tell me what you think the priority is for today?
Well, I think last time she was experiencing postpartum blues that typically occurs 2 to 5 days after giving birth and consists of mild depressive symptoms such as sadness and emotional instability. So I think this time giving her the Edinburgh again would be good to see if it was postpartum blues or is actually postpartum depression.
That is definitely a priority. Do you have any other questions?
No, I don't think so.
Okay, let's go. Hi Chelsea, good to see you again. As I mentioned on the phone, this is Rochelle. She's a nursing student from the University of Calgary and will be observing if that's still okay with you.
Yeah, absolutely. Nice to meet you, Rochelle.
Yeah, you too.
How have you been doing since last time?
I've been doing really good, actually. I took your advice and I went to ParentLink, and I've been meeting with some mothers in the community once a week. So I've definitely been getting more me time, and therefore it's kind of been making me feel more like myself since Lily's birth.
That's so good to hear. Last time I had you fill out the Edinburgh postnatal depression scale, asking about your emotions and coping ability. Would you be willing to fill it out again?
Yeah, absolutely.
Awesome. Before I get you to fill it out, a couple questions if that's okay. Have you been feeling depressed, sad, or hopeless lately?
No, I've actually been feeling really good.
That's great. Have you found that you've had little interest or pleasure in doing things?
No, quite the opposite, actually.
Good. All right, well here's the form. When you're filling out the form, can you just think about the past 7 days, not just today?
Yeah, absolutely.
Thank you very much.
Have I been able to laugh? Well, I have been finding my husband funnier than usual. Feeling like harming myself? Thankfully, I've never felt that way. Alrighty, I'm all finished.
Perfect, thank you.
That was definitely easier than last time.
I'm glad to hear that. Now I'd like to hear about Lily. How's the breastfeeding going?
It's actually been going really well. She's been latching a lot easier, and ever since my mood's been better, hers has been better.
That's good. Sometimes your mood can impact Lily's mood. Do you have any other questions or concerns?
No.
Okay, so I will give you my business card. If you are feeling overwhelmed, anxious, inadequate, or just feel like yours or Lily's safety may be at risk, I want you to give me a call. I want this transition to be as smooth and positive as possible for you.
Perfect. Well, thank you so much. And I just want to say thank you to both of you. You guys have helped me and my family achieve our goals, and that means a lot to me.
Thanks for saying that. I can't wait to see you at your 3-month follow-up appointment.
Sounds good. Thank you again.
Thanks. How do you think the visit went?
Well, it was nice to see theory put into practice and to see the relationship that you've built with Chelsea. Research shows that therapeutic relationships built on mutual trust can increase the success of interventions provided. You also used a strength-based approach and validated her feelings as well. So I think you really showed how nurses can impact Chelsea and her family and help them reach their goals.
Good. Last time Chelsea scored an 8 on the Edinburgh, this time a 2. What do you think the difference is between then and now?
Well, a score of below 9 usually means that no physician follow-up is required, but ongoing support in the community would be recommended at this time. And a score of 2 indicates significant improvement, but she's also acknowledged through her increased comfort and mood in her new role. She also appears to be bonding really well with Lily. She's mentally alert, and she's seeking support through the community with ParentLink.
Those are great observations. I appreciate your research and preparation, and being able to recognize best nursing practice in regards to postpartum care.